hypermobility and rib subluxations are so common, a lot more common than most people realize. The issue there is most bendy individuals think that's just how everyone is, and the answer is no, that's not true. So let's talk about rib subluxation. So imagine my fingers are your ribs are connected to your chest bone, your ribs are connected to your back, your mid-back area, and you do have floating ribs. Those are the ones that kind of they're not attached to the front, and they tend to float. They allow the expansion of your abdomen in the process of breathing in. We've done a video on hypermobile breathing that we're going to put at the end of this video, so you get to watch it. It's so important for you to really get a good grasp of how to breathe for better stability of your trunk. But let's not digress. Let's go back to rib subluxation. So with the rib subluxation, what's happening is the connection of the ribs to the chest bone or to the thoracic spine, to the mid-back, where that's connected, the tendency is for the head. So let's pretend this is the mid-back and the rib is connected. What ends up happening is the rib, because of gravity or because it tends to fall downward. So if it's here and it is to stay stable in case of subluxation, because of connective tissue disorder where these two are connected, this tends to fall downward. Now there are these dermatome nerves, there's sensory nerves that tend to go along the bottom portion of the rib. So when there is that subluxation and it falls down, it irritates the sensory nerve, and that's where the discomfort comes from. I am working heavily on coming up with the right way to tape or to stabilize or to minimize the chances of that drop. When I find that, I promise I will do a video on that. That's a work in progress. The whole practice, my whole practice is pretty much geared towards joint hypermobility and EDS, thus the name. And that's, I'm all about what can I do to make it easier so you have less of a instability and more of a better time. And most importantly, how can that information be transferred to you so you can take better care of yourself? My whole theory when it comes to joint hypermobility is I look at it as packaging your belongings and putting them in a truck to move it. Some of those belongings you can just throw in a box and just tape it and put it in the truck. Some of them you need to bubble wrap and make sure that they're attended to, because they're your heirlooms, they're like your precious set of china. So just because you need to bubble wrap them and make sure you write down, fragile, handle with care, does not mean that you leave them behind because it takes too much. You just learn how to package it better so it does not break in the process. Obviously, you're not going to break, but you need to, as a hypermobile individual, it's smart to learn how to package yourself better. So packaging yourself better means proper breathing. Proper breathing means the closer breathing that's closest to the way we all breathe as babies. When it comes to hypermobile individuals, I refer to that as hypermobile breathing. Anyway, I just want to make sure that you understand what subluxation is and what your options are. Like I said, there is a better way to, I have done a video on the sleeping and the pillow use for the bendy. And there are these wedge pillows that seem to be working. They're bendy approved, meaning they seem to be working with rib subluxations that happen when you are sleeping. So we're gonna put the Amazon link of my favorites and the bendy approved products on Amazon or off Amazon that I share with my patients, and I hope that you find them helpful for you. Thanks for watching.